I've practiced medicine for over 3 decades, and I've served on the board of the Maryland Society of Integrative Medicine, MSIM, almost since its inception. I didn't plan to become an integrative physician. It wasn't part of the original plan. But as I began to see patient after patient come back with the same chronic issues, I started asking deeper questions. As a primary care doctor, I realized that most of what I was doing was treating symptoms with pharmaceuticals. And while that sometimes helped in the short term, it didn't feel like true healing. It felt like I was putting out fires that would just reignite somewhere else. My name is Dr. Bloem. I'm an integrative and holistic physician in Kensington, Maryland. I've practiced medicine for over 3 decades, and I've served on the board of the Maryland Society of Integrative Medicine, MSIM, almost since its inception. Early in my journey, I thought that if I could just help my patients lose weight, their problems would go away. And sometimes it did help, but only on the surface. Over time, I began listening more closely to my patients. Some were exploring alternative or holistic approaches, and they were improving in ways I couldn't explain with conventional medicine alone. That experience changed everything. I started attending conferences, reading everything I could about functional and holistic medicine, and connecting with colleagues who were also seeking a deeper understanding of healing. That curiosity opened the door to detoxification, hormone balance, regenerative therapies, and energy-based medicine, all grounded in science, but aimed at restoring wholeness. What I love about integrative medicine is that it doesn't stop at what diagnosis do you have. It asks, why did this happen and how can we restore balance? It treats the person, not just the disease. And I've seen the results firsthand. My patients recover their energy, their focus, their hope. They begin to live healthier, more vibrant lives than they ever thought possible. It's transformed my practice, and it's transformed me. But integrative medicine is under threat from restrictive regulations, from systems that reward procedures over prevention, and from a culture that sometimes fears what it doesn't yet understand. That's why I believe so deeply in MSIM. The Maryland Society of Integrative Medicine stands up for patients, for practitioners, and for the freedom to practice medicine that heals, not just manages. If you're a practitioner who believes medicine can be better, join us at the MSIM. And if you're a patient who values integrative care, please support our work and help protect your access to this kind of healing. Integrative medicine bridges science and healing, and it deserves to be protected. Together, through MSIM, we can make sure it always will be.